Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
From the St. Louis Public Radio Newsroom, this is The Gateway. It's Thursday, May 2nd. I'm Abby Larico. Illinois Governor JB Pritzker wants state employees to have access to medication to help them lose weight. But the price tag and how it was passed has lawmakers and taxpayers outraged.
Dropping a bill out of the air on the last day of session with something in it that nobody knows about and then blowing the doors off the budget, that is insanity.
Covering drugs like Ozempic for state employees on the taxpayer dime. That story coming up on The Gateway. The Missouri Senate was at a standstill for more than 40 hours due to a filibuster, which ended early this morning. As St. Louis Public Radio's Sarah Kellogg reports, members of the Missouri Freedom Caucus said until the Senate passed a resolution making it harder to amend the Constitution, they would hold up the passage of a tax that funds a bulk of Missouri's Medicaid program.
5 senators, all members of the Missouri Freedom Caucus, began their filibuster of the federal reimbursement allowance at around 10:30 a.m. Tuesday. The allowance, which is a tax on hospitals, ambulance districts, and other healthcare-related providers, funds roughly $4.3 billion of the state's Medicaid system, which is about a third of the total cost. Senate Minority Leader John Rizzo said the filibuster is a reason why the Senate should have taken up the tax sooner.
We all knew how important this was. Every senator from the top senator to the last senator understood this was essential to passing a balanced budget, to keeping rural hospitals open, to keeping nursing homes open.
The allowance is set to expire at the end of this September. The legislation up for debate would extend the tax through September 2029. In Jefferson City, I'm Sarah Kellogg, St. Louis Public Radio.
A group advocating for a higher minimum wage and paid sick leave in Missouri has submitted signatures for a proposed state law change. If the change is passed by voters, the minimum wage in the state would increase to $13.75 an hour beginning in 2025 and eventually rise to $15 an hour in 2026. Members of Missouri Jobs with Justice say they turned in more than 210,000 signatures yesterday to place both a higher minimum wage and paid sick leave on the ballot. The Secretary of State's office now has to verify those signatures. The change would also require employers to provide 1 hour of paid sick leave to employees for every 30 hours worked. According to the Secretary of State's office, roughly 107,000 signatures are required to put a statutory change on the ballot. Signatures for both proposed statutory and constitutional changes are due May 5th. Days after more than 100 protesters were arrested on Washington University's campus, demonstrators decrying Israel's military attacks in Gaza marched through St. Louis University without incident. St. Louis Public Radio's Jason Rosenbaum has more on what the protesters want.
Demonstrators marched, chanted, made speeches, and prayed in and around SLU's campus on Wednesday. They're calling on university officials to demand a ceasefire in Gaza and for SLU to cut ties with weapons manufacturers like Boeing. SLU English professor Joya Urazi says it was vital for students to converge in the wake of arrests at Washington University and at places like Columbia University in New York.
Seems to me it would be egregious of us not to.
The protest broke up largely without incident after about 3 hours, right before rain swept through the city of St. Louis. I'm Jason Rosenbaum, St. Louis Public Radio.
Missouri child abuse investigators missed warning signs that parents were taking fentanyl before those parents' children died of accidental overdoses, according to a new state report. A committee looking into several dozen fentanyl overdoses among kids found that Children's Division workers needed better training on how to handle encounters with the deadly drug. They are also stressing better communication with juvenile officers who could help remove kids from an unsafe environment. Emily Van Shinkoff is the executive director of Missouri Children's Trust Fund. She says the report should spur policymakers into action.
Something needs to change very dramatically in our child welfare system if we want it to achieve its intended goals and purposes, because it's not working particularly well in Missouri, and it's not working particularly well nationwide.
Child welfare advocates are also calling for higher pay for investigators, primarily so they can stay on the job. United Methodist Church pastors will soon be allowed to host same-sex weddings. St. Louis Public Radio's Lauren Brennicke reports local pastors will have to decide how to apply the new rules.
The changes also allow for LGBT clergy members, reversing a rule upheld by Missouri church officials in 2019. The General Conference allowed church leaders to vote on whether the ban would continue. In March, Bob Farr, Bishop of the Missouri area, prepared Missouri attendees for the conference.
It's a removal of restrictions barring churches and UM pastors from presiding and hosting same-sex weddings. Hear this, friends. There's not a single proposal for making people.
Representatives voted 692 to 51 in favor of allowing LGBT people to marry and become ministers in United Methodist churches in the U.S. Local leaders will vote on regional adaptations during the annual conference in June. I'm Lauren Brennicky, St. Louis Public Radio.
Today, St. Louis Mayor Tashara Jones and St. Louis County Executive Sam Page are taking regional business to Canada. They'll join a group of 30 local delegates in Montreal and Ottawa for the next several days, working to promote trade with Canadian businesses. According to the Economic Development Partnership and World Trade Center St. Louis, 17 Canadian companies have locations in St. Louis, and Canada is the St. Louis region's largest trade and investment market. In 2022, Missouri exports to Canada totaled $5.6 billion. That's mostly from transportation equipment and chemicals. The delegation will leave today on the inaugural nonstop flight from St. Louis Lambert International Airport to Montreal, an expansion of direct service to Canada. Illinois taxpayers could be on the hook for hundreds of millions of dollars to help state workers lose weight. That's because last May, Governor JB Pritzker's office quietly helped push a plan to cover the costs of injectable weight loss drugs for enrollees in the state health insurance program. Dave McKinney has more.
Drugs like Ozempic or Wegovy have been called miracle drugs, talked up by the likes of Oprah Winfrey and former NBA star Charles Barkley for how they dramatically help people shed weight.
You know, man, I started this drug called Manjaro about 6 months ago, and I'm down 57 pounds. It's been amazing.
That's Barkley last year on ESPN's Pat McAfee show.
I have zero idea what it does. I know it's working, though.
These injectable weight loss drugs can cost as much as $16,000 a year, and it's a struggle to get health insurance to cover it, except for a fortunate few in Illinois. State workers get the drugs insured for their obesity beginning July 1st in a move that could be a slam dunk on Illinois taxpayers. Pritzker's office defends its under-the-radar push to cover the drugs for obese government employees, saying it'll lead to a healthier workforce and eventually lower health care costs. But the 4-sentence add-on to the 899-page budget bill comes as news 11 months later to some lawmakers steeped in knowing the state budget. I asked Republican State Senator Chapin Rose when he found out about it.
When you called me.
It's even bigger news to Rose that the Pritzker administration expects the cost to be $210 million for 1 year.
Dropping a bill out of the air on the last day of session with something in it that nobody knows about and then blowing the doors off the budget, that is insanity.
Emails WBEZ obtained show the initiative was first proposed by Pritzker's chief of staff and that it proceeded despite warnings about the cost from the governor's own budget director and the head of the agency overseeing the state insurance program. And at least one expert thinks the cost could be higher than $210 million. Ryan Cummings is a former White House economist under Democratic President Joe Biden and has studied how these costly drugs can be government budget busters. In one scenario, Cummings estimates the new coverage mandate in Illinois could cost 3 times the state's estimate, depending on the number of people who access the program. If that happens, Cummings warns hard budget choices await the state if it can't win cheaper prices for the drugs from pharmaceutical companies which can't seem to produce them quickly enough.
Do you force people to pay more in their premiums? Do you issue new bonds to finance this? Do you have to raise taxes? Or do you tell people who are on it, sorry, you got to get off of it now, and now you're going to gain your weight back? So again, there's a lot of invidious choices if we can't figure out collectively as a government and as policymakers a way to get the cost of this drug down.
Pritzker's office dismissed Cummings' calculations, calling them, quote, a back-of-the-napkin cost analysis. Even if the Pritzker administration's own estimate proves true, an unexpected $210 million bill coming due is something Democratic State Representative Fred Crespo wishes he'd have known last year instead of learning it from WBEZ. The veteran lawmaker chairs one of 5 budget writing committees in the House, and like others, didn't spot the weight loss drug component in last year's budget implementation legislation, known in Springfield as the BIMP bill. No one mentioned it.
This initiative for obesity was put in the BIMP bill, and to my knowledge, it was never vetted. It was never discussed. That's a dangerous game.
As loud as backers like Charles Barkley trumpet the impact of injectable weight loss drugs, their supporters in Springfield have mostly stayed quiet. Now, the cost of that silence is coming due in a big way. This is Dave McKinney.
That piece comes to us from partner station WBEZ in Chicago. The Gateway is a production of St. Louis Public Radio, a listener-supported service of the University of Missouri St. Louis. Music by Ryan McNeely of Adult Fur. I'm Abby Larico, and from the St. Louis Public Radio newsroom, this has been The Gateway. Have a wonderful Thursday.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.